since the pandemic. A new campaign has been launched in Sheffield today to make patients and public think about the consequences of their behaviour. The latest research shows that nearly all primary care staff have experienced verbal abuse. A third have received threats of violence. And police figures show that the number of violent incidents at GP surgeries doubled between 2018 and 2022. Kathy Killick has been speaking to reception staff from one surgery in Sheffield.
Attacked and assaulted while simply trying to help. As these CCTV images from surgeries across the country show, patients abusing NHS staff is now becoming commonplace. GP receptionists Yvonne and Liz have decades of experience between them. They've noticed a marked increase in abuse over the last 5 years.
It's getting worse. The threats were getting more. I'm going to come and get you. I'm grabbing all the computer wires, threatening to throw computers. I myself was smacked by a young man who, all right, special needs. But if I hadn't have been stood where I was, lots more people could have been hurt.
We get sworn at on I would say, on a weekly basis, if not a daily basis. I've got called names. I've had like somebody go like that to my head. Pew, pew. It's not like you get a lot of money for doing what we do, and you try to do it to the best ability, and sometimes you just get demoralised.
Good afternoon. Come and have a seat.
Thank you.
Dr Lucy Cormack oversees GP's surgeries in Sheffield. Some have had to introduce self-defence classes for staff because of the abuse. Others have seen staff leave, creating staff shortages that benefit no one, least of all patients.
I just think it's really upsetting for our teams and for our staff. Absolutely. Receptionists come to work and they genuinely care. They want to do something to make a difference. And so to see them, and I do think they take the worst level of abuse, to see that happening, it's really upsetting, for us, because that's what we're here to do, is to help people.
Liz recently had to have time off because the abuse affected her mental health. She's right behind a new campaign launched in Sheffield which asks abusive patients to think about the wider consequences of their behaviour.
I've actually left a job because the threats were getting worse, and I knew that I wasn't able to protect my colleagues.
Staff not only get de-escalation training to take the heat out of abusive encounters, they now also get personal safety training, a sad indictment of the skills needed by people who truly only want to help. Kathy Killick, BBC Look North, Sheffield.